Heart failure occurs when the heart can't and doesn't pump well enough to meet the body's demands. Remember that the heart pumps, it pumps blood around to the body, the organs. Remember, blood has oxygen in it. And when you have heart failure, your heart literally can't pump as well to meet the demands of your body. And this causes problems. This is one of the more important videos that I have done and think I will do because I need you to understand the signs, potential signs and symptoms of heart failure. There are 9. I need you to watch to the end because the last 3 are probably the most common signs and symptoms I see, and some of the most troublesome as well. Guys, I'm Dr. Jen. It's good to see you. One of the signs of heart failure can be an increased heart rate. Okay. Now, by the way, the signs and symptoms I'm giving you can occur in people who already have a diagnosis of heart failure. People who have a diagnosis of heart failure oftentimes are controlled with medications and different therapies that their cardiologists and doctors are prescribing. But sometimes you can have an exacerbation of your heart failure, meaning you have periods where it gets worse, depending on maybe what you eat or what you do or what's going on in the world or a change in your medications or anything. Okay. So these symptoms really apply to both. Increase in heart rate can be a symptom of heart failure. Okay. Doesn't have to be. An increase in heart rate can be a sign and symptom of something else. But if your heart rate goes up, now remember a typical heart rate, I have videos on this, is between about 60 and 100 beats per minute. Okay. That is, I would say, for the average individual. You need to talk to your doctor about what's right for you. But if your heart rate goes higher than that or higher than what's normal for you or becomes an irregular rhythm or something strange, you feel palpitations, etc., that is something we worry about. Number 2 is fatigue and tiredness, just simply feeling worn out, like, oh God, I'm just exhausted. I just need to sit down. And so you'd say, well, how would you know? Well, you could simply feel exhausted like that. But the other thing is you might just notice that you're just not able to do or not wanting to do the activities you normally do. Maybe you choose not to go to the mall, for example, or to the festival or to something because you know you're going to have to walk around and you don't think you have the energy for that. So remember, fatigue and tiredness can present in a number of ways, but yes, this is an important and often common symptom of heart failure. The next one is persistent coughing or wheezing. That's right. If you have a cough that gets worse or you start to wheeze, even if nothing else is going on, and by the way, I should say, not only are those symptoms to see your doctor, every single symptom I am mentioning in this video is a reason to see your doctor because it could be signs of heart failure. But remember, these symptoms could also be signs of other things. The next symptom is nausea or a lack of appetite. Now, this is a symptom we may not always think about when it comes to heart failure or heart failure exacerbations. But interestingly enough, you could have gastrointestinal symptoms in your stomach where you simply feel nauseous. You want to throw up, feel like you have a decreased appetite. Okay, again, doesn't have to be heart failure, but certainly could be. The next symptom, this is one that we've learned this in medical school very specifically. We think about this, it's when we think about it this way. When you go to lie down for bed, okay, you're like laying down in your bed, etc. Are you able to sleep comfortably lying on your back with your normal pillows? You just feel you're able to sleep? Or when you lie down on your back, do you feel like you're getting short of breath? Do you feel like you need to prop the head of your bed up with some pillows and raise it up a little bit because lying flat, you don't feel right? Okay, that can be a potential sign of heart failure where you get shortness of breath, you can't sleep, you can't breathe well when you're lying flat. So you find yourself manipulating your bed environment, your napping environment, so that you're not laying flat. That should be a sign to see your doctor, okay? The next one is sometimes heart failure, if it's advanced enough, if it goes on long enough, can cause confusion, can cause what we call mental status changes, which means you're not thinking right. And this is an emergency, okay? This is certainly a severe complication of heart failure. And now, let me go on to the last 3 signs of heart failure. They are no more important than the ones I mentioned, but as a family doctor, these are the ones I see most commonly, and these are the ones my patients complain of most commonly that has led to heart failure diagnoses, okay? The first one is sudden weight gain, okay? All of a sudden, it's like you gain like 10 pounds, and something doesn't seem right. You may get on the scale. Your scale is high. You're like, what is going on? Okay, I'm going to explain to you what that what that weight could be. And it's not weight from just eating too much, but a sudden weight gain, like your weight shoots up. By the way, for people who have heart failure, write in the comments if you have heart failure, if you ever experienced this, because by the way, what you write, I know is going to help other people who are watching, okay? But how many of you with heart failure out there monitor your heart failure symptoms by your weights? It's actually one of the things we prescribe, daily weights or weighing yourself and knowing that you should be between a certain weight for your normal. And if it goes above that, you could potentially have a heart failure exacerbation. Let me just tell you what that is. I said it's not that you're eating too much. It's not. It's fluid. Okay. One of the most common things I see that is a sign of heart failure is excess fluid. And oftentimes that can come out, whereas you get on the scale or you're like, gosh, I've just gained a lot of weight. And it's fluid, the fluid that goes in different places. I'm going to describe where it goes next. All right. So sudden weight gain. The next, and this is no particular order, is swelling. Okay. And this is where the sudden weight gain comes in, is you get swelling. Usually people get weight gain, but it comes with swelling. The legs get big, almost like tree trunks, or it doesn't even have to be that much. It can just be a little bit of swelling. You can get edema where you can see that your socks leave like an indent on your ankles and things like that. I have videos on edema and swelling in your legs, swelling in your ankles, swelling in your feet. Sometimes people even get swelling in their abdomens. I've had, and this has happened a few times over the last number of years that I've been a physician, and I've been a physician for almost 20 years at this point, where every now and then, it doesn't happen often, but somebody comes in with what we call whole body swelling, anasarca-like, which means they get swelling in their abdomen swollen. You can see that their arms are swollen, their legs are swollen, but not just the lower leg, the upper leg too. In many of those situations, heart failure has played a role in that. But it doesn't have to be that dramatic. Just be in your ankles, your feet, your lower extremities, your lower legs. Okay, so swelling that's unusual for you. And the last one that is certainly really, really tough and often a telltale sign of congestive heart failure is shortness of breath. Now, shortness of breath is something that sometimes it's hard to quantify. When I say shortness of breath, what I mean is you can't walk from here to the living room or to the bathroom or the bedroom the way you normally can. You find yourself getting out of breath, going just normal distances that you could go before. These are the types of signs you need to be looking out for, what you will notice in real life. Also, when you're breathing, if your breathing is interrupted with coughing or wheezing, that can be a sign of heart failure. But that shortness of breath, and oftentimes it just means you're just exhausted. You have to catch your breath. You can't walk as far. You can't do as much. You can't wash a full load of laundry. You got to take a break. Oftentimes, that is a sign of shortness of breath. It could mean congestive heart failure. It could mean other things as well. So that swelling, sudden weight gain, shortness of breath, any or all of those things are the most common symptoms I see. Understand that these are the symptoms I gave you, 9 important symptoms of congestive heart failure, but you might have others. Write in the comments again, if you had CHF or congestive heart failure, what symptom was your presenting symptom? How do you manage it? Educate me and other people who are watching this video. Guys, I'm Dr. Jen. Please subscribe to my channel. Follow me on Facebook. I'm on Instagram, TikTok, LinkedIn, WhatsApp, etc. Also sign up for my free health newsletter at drjencaudle.com. Love y'all.